Hello, everybody. Welcome. Tonight, our guests are Abby and Reid Gray. Reid is an ulcerative colitis and liver failure patient with no cure. The couple has experienced infertility and multiple heartbreaking pregnancy losses. Reid had a directed liver transplant, and they experienced the birth of miracle twins. Abby is a biographical author. They are organ donation advocates, and Abby has a website called abbygraywrites.com. Their love story begins when they met in 2011, leading to their engagement on December 7th, 2012, and their subsequent marriage on March 29th, 2014. As they began their life together just 2 months after their wedding, Reid was diagnosed with ulcerative colitis and primary sclerosing, I'm going to mispronounce this, Changolitis, PSC, a rare liver disease with no cure. At the same time, the couple faced a horrific series of medical setbacks, including 4 years of infertility and pregnancy losses. However, the story took a miraculous turn in 2019 when all hope seemed to be lost when Reid received a life-saving liver transplant through a direct donation just months after his transplant. Then Abby gave birth to their miracle twins on April 11th, 2019, Oliver and Kaylee. Presently, Abby and Reid are advocates for organ donation and raise awareness and encouragement for those facing challenges of PSC and infertility. Abby is the author of Impatiently Waiting for Miracles, and I do mean detailed memoir of their journey, and a children's book, Clayton Sparks Leaves His Mark, written to honor Reid's donor. Their story is a remarkable reminder of the resilience that it takes to overcome even the most difficult obstacles and somehow to expect miracles. Please give a warm welcome to Abby and Reid Gray, a powerhouse duo with a story that will inspire and uplift, a couple who has turned pain into purpose and setbacks into strength. Guys, how are we doing this evening?
Good. How are you?
All right. Did I state everything correctly in the introduction?
You did. Yes, you did.
All right.
And it's primary sclerosing cholangitis.
Okay, I'll take
There you
your
go. Or
word
you
for
can
it.
just call it PSC.
Yes, ma'am. PSC, I can work with that.
There you go.
Abby, please tell us a little bit about where you grew up, your education and employment experiences.
Yeah, so I actually grew up in a really small town. Well, I say really small town. Oh, our power just flashed. We have a storm going on here in Houston.
Uh-oh.
Hopefully that won't happen again. But so I grew up in Huntsville, Texas, not Huntsville, Alabama, but it's about an hour north of Houston. And I grew up my parents were very, very involved in the business community. And so I was involved in the business community as a child. And so I was constantly around some really powerful kind of business leaders and people that were constantly helping and doing for others. And so I grew up seeing the power of connections and the power of, surrounding yourself with people who wanted to help. And so that kind of led me into nonprofit work. And I worked for a nonprofit doing fundraising and marketing in college, and then after college went to the Greater Houston Partnership, which is like the big chamber of commerce for Houston. Did more events and marketing and membership type things there, and then did some project management with a relocation company after that. And so kind of a little bit of different things, but I did get my degree at Sam Houston which is in Huntsville, and I got my degree in marketing. So that kind of led me into where my career path went.
Okay. Reid, the same question. Tell us a little bit about where you grew up, your education and employment experiences.
Yeah, so I grew up in Indianapolis, Indiana, and went to Purdue University, which in Northwest Indiana. I did a 5-year stint at Purdue and graduated with a degree in mechanical engineering. Never had any intention of leaving Indiana, but when I graduated in 2009, there was basically nothing. The economy was bad, and there was nothing out there for people except oil and gas. So in Houston, oil and gas was still going. So I got an offer at a company in Texas, and moved down here with several people from Purdue because it was one of the only places giving offers. I've been at the same company for 16 years now as a mechanical engineer, and support offshore facilities and oil production.
Wow. Okay, we got a power couple tonight. Let's talk about how you two met and how your story begins. Abby, I understand that you met in 2011. Can you please tell us a little bit about that first meeting and your first impressions of Reid?
Sure. I went out with some friends one night, and one of them said, I have a guy for you. I have a guy I'd like to introduce you to. And I was like, okay. And she said, he's really nice, really tall. He's an engineer. He's, great guy, funny. Can I give him your number? And I'm like, sure. Not sure that he'll actually call. And a couple weeks later, he did. And we ended up going on a blind date. So it was the first blind date for both of us, first and last. And we ended up at the restaurant that night for I think 4 hours, and we're just talking and didn't even realize that the restaurant was trying to close around us. So we've been together ever since.
Oh, wow.
Yeah.
Reid, what were your initial impressions of Abby?
I mean, I was excited from the moment we met. She was very confident when we spoke. The dinner we had, we kind of hit it off. She said we talked for hours. Seemed like very easy to talk to, which was important. From that, she's just very kind-hearted. I could tell that she had a very strong relationship with all of her family. I'm sure she'll mention, but she's got a ton of family here. And during our first date, she confirmed that I was never going to pull her away from them and make her leave Texas. That would have ended right there if I had said anything otherwise. So yeah, I was very impressed with her initially and continue to be. So.
Reid, I understand that you became engaged on December 7th, 2012. Do I have the date right?
Yes. Yeah, it was about a month after I got back from working offshore. I did about a year where I was offshore every other 2 out of every 4 weeks. I came back onshore, and about a month to 2 months later, I think we got engaged.
Okay, I remember reading something about absence making the heart grow fonder.
Yeah. Yes. I did not.
So,
like
Abby, I have you married on March 29th, 2014. Do I have the date right?
Yes, we took about a year and a half to plan the wedding. Whenever I say we, I mean me, and my mom and my sister, my best friend, because we had to get everything just right. So.
Okay. Reid, when did you first begin to experience symptoms of stomach pain related to your ulcerative colitis? Come on, Jim. You can talk. It's okay.
I didn't notice it until our honeymoon. We went to Greece for our honeymoon, and I don't know if it was the different foods or just the travel or what it was, but something started bugging me there. I thought it was just normal travel sickness, and when I got back, it didn't go away. So something seemed to trigger it on that trip, and it just continued to get worse until finally we went to see a doctor a few months later. So.
Yeah, my notes are telling me that you saw Dr. Reid, a gastroenterologist, and he's the one that also diagnosed you with PSC. Can you tell me a little bit about that?
Yeah, so we went just to look at my stomach, figure out what was going on there. We ended up doing a little bit of testing. I think I did an ultrasound, and was diagnosed with UC. And he asked while we were there, "Is there anything else bothering you?" And I brought up the fact that I had been denied life insurance several years prior, in 2010, for high liver enzymes, and it was undiagnosed for 4 years. I'd been to several doctors; nobody could figure out anything actually wrong with me. So I just kind of gave up looking and assumed it was a fluke event. I told him about that, and because of the ulcerative colitis, he knew to look for PSC. They have a very high correlation with each other. So having the one diagnosis sort of led to the other, and I kind of learned what PSC was at that point.
Okay, can you tell us a little bit about what PSC is?
Yeah, it's a disease in the liver that causes scarring and dilation of your bile ducts. It causes bile to back up into your liver, which will eventually cause your liver to fail. There's no cure for it. It doesn't affect very many people. There wasn't much known about it when I was diagnosed. There's quite a bit more that we know today, but still no cure except for liver transplant. It's very slow to progress and typically affects people that are a little bit older than I am or than I was at the time. And so it just seemed like I was one of the unlucky ones that was diagnosed at a younger age. So.
How old were you when you were diagnosed, Reid?
28.
That's young.
Yeah.
What was your reaction?
I was kind of, I guess, understandably scared and disappointed, very sort of pessimistic about it all. They told us in the appointment that, like I said, there is no cure. They told us that we might need a liver transplant one day. It progresses slowly. It might not progress at all. So there was a lot of unknown moving forward. I took all that to mean that I was sick, I needed a liver transplant, or I was going to die, and was not my normal way of reacting to things. It's sort of goes against the way I usually react to news like that. But in that particular case, for whatever reason, I was very pessimistic about it all.
Abby, what course of treatment was recommended for the UC and the PSC?
So they said that they could put them on some medications to hopefully help with the ulcerative colitis and get it in remission. And they would do regular endoscopies and colonoscopies and, just to check the progress of that. The PSC, so there was, a fairly straightforward, path for that one. The PSC was kind of, we're going to have to wait and see. We can try this medication, but we don't even know for sure if it helps. There wasn't a lot of research that had been done at the time on the medication, and they still haven't found one that believe, I don't want to talk out of turn, that has, that is a complete cure that will cure you of PSC. And as you and I both know, a liver transplant is actually not a cure, it's a treatment. And so, for them to say that, I was actually for once the optimistic one and thought, they're saying that it's probably going to be way down the road. And, some people with PSC never have to have a liver transplant. They are, fine. And yes, they have some challenges for sure. But, I thought, oh, well, we'll kind of deal with that when we get to it, thinking we had quite a while until it might progress.
Okay. Reid, stupid host question. Is this a recurring problem? Like some of my friends that have kidney transplants, the disease like FSGS can come back and affect their transplanted kidney. Can this disease affect your transplanted liver?
It can. The numbers we were given when we went through the transplant process were around 40% recurrence. But the longer you go with the new liver, and the longer you are post-transplant, the more that number drops. So where I am now at 6 years post-transplant, it's quite a bit smaller.
Yeah, we feel a lot better about it. I mean, exactly. The chances are still there, but we feel a lot better.
I am also on some immunosuppressants in addition to the ones that most transplant patients are on, that I will be on for forever, probably, that also help sort of keep that away, they think. So.
Okay. Abby, approximately when did you as a couple decide that you were going to try to have a baby?
Well, so we got married in March, and around August, I finally convinced Reid, okay, I would like to have kids soon. He still had the disease in the back of his mind, and, was concerned about that. But my mom had gone through a couple of pregnancy losses and before she had me. And so that was always something, and she was always real honest with us about it. And so it was always something in the back of my mind that I knew was possible. And I was always, I knew that there was potential for us to have some infertility issues. And so I wanted to get started on that pretty quickly. So August, he finally conceded to my argument. Yeah.
Okay. When did you discover that you were in fact pregnant for the first time?
So that following April, 9 months later, which at the time felt like 9 very, very long months, I went to go get a spray tan for my cousin's wedding. Like, seems like a silly thing, but while she was spraying me, I got really dizzy. And my friend that was with me, Amy, she said, Abby, you're pregnant. And I was like, no, I highly doubt it. Like, it's been 9 months. And at that point, I had already convinced myself we would need a fertility doctor. And so I was like, no, it's, waited till the next morning and I tested and I was indeed pregnant. So we were both in shock and quite excited and I rushed to the doctor and, started and got my blood work drawn. It was a Friday. And we started sharing the news very quickly with our family because we were just so excited about it.
Okay. Reid, what was your reaction when you first learned that Abby was pregnant?
She said excited. That was definitely there. I think initially it was relief after several months of trying and most every month we would deal with that disappointment. So relief that wasn't something we had to deal with that month. And then almost immediately transitioned to being terrified. that we weren't ready and would never be ready, and also, that I still have my health issues to deal with. I mean, it was like she said, it was always in the back of my mind, and I was always worried that I was not going to be around whenever we had kids, and so the thought that she was pregnant now meant that was a very real possibility. So.
Okay. Abby, approximately when did you learn that you had an ectopic pregnancy?
So a couple weeks after, so the following Monday, I went in for the blood test on Friday. The following Monday, I got a call from my nurse, and she said, and I was very, I guess ignorant would be the word, to thinking that, okay, the test shows positive, I'm pregnant. There's nothing, that we're pregnant. And so I wasn't expecting any bad news to come. And on Monday, she called and said, your numbers are really low. And so either, our dates are off or you're having a miscarriage. And I was like, miscarriage? What do you mean? And so we ended up going in for blood work every couple of days after that. And they wanted to see the numbers rising. And the numbers were rising, but not at the level that they should be. And so we remained cautiously optimistic. And, we're just hopeful that it was just kind of a slow start. And we went in for an ultrasound, and they said, well, we can't see anything in the uterus yet, but that might be totally okay. There may be something in your fallopian tube, but it may just be a cyst. We don't know. We'll wait a couple more days and see. And so a day or two after that ultrasound, I was in intense pain. My stomach was hurting so bad, and I thought that it was effects from the medication that I was taking, because I'd been given progesterone, and that has some side effects with it. And so to support the pregnancy. And so I went to reach for a bowl in the cabinet and doubled over in pain. And I was like, okay, something's wrong. I've got to go to the ER. So I called Reid, and I ended up meeting him at the ER. And they did an ultrasound and learned, the doctor came in and said that the pregnancy was ectopic, which I knew what that was right away. Reid did not know what that word meant, which if you haven't experienced it or know someone that has experienced it, you might not. And they thought at first that I was having a heart attack, because all of the machines started going crazy. I was really just having a panic attack. I couldn't breathe, and I was, kind of hyperventilating, because I knew what that meant. And they were saying that they were going to have to rush me into emergency surgery, and my pregnancy would no longer be there. And so I kind of gasped for breath and said, tell him what's going on, because, I knew that he didn't know at that point. So that was our first kind of really hard moment throughout that process.
Reid, what was your reaction to the diagnosis and the immediate surgery that Abby had?
Well, like I said, I didn't know what it was. I could obviously tell something really bad was happening. The way she reacted was very visceral. But yeah, I was immediately concerned for her. I wasn't, ignorant at the time. I was not. It did not even cross my mind that meant we were losing the pregnancy. I was extremely concerned that something was going to happen to Abby, and that obviously was not where her head was. But yeah, that was tough. The surgery, sort of as it was happening, they were explaining to me what was going on, and that's where it all sort of sank in that, okay, that we're back to trying. We're back. We got to start this process all over, and sort of had the time during the surgery to sort of process, reshift to the new line of thinking. But yeah, very disappointed, very scared. Yeah.
Okay. Abby, I read that subsequent to the loss of your first pregnancy, Reid's health began to deteriorate. Can you please describe for us what your observations were?
Yeah, so at first, it was really kind of slow at first, but then like he would come home and like fall asleep on the couch. Like he was just so tired. And he started itching, and it was like this itch like that he couldn't scratch, like underneath the skin, like internal. And just of course he was still dealing with the ulcerative colitis and some of the symptoms as they tried to get that in remission, and so he wasn't feeling great, but it wasn't like terrible. It wasn't like a dramatic change.
Okay. Abby, I understand that you began the process of in vitro fertilization. Approximately when did you start?
Well, so we went through about after our ectopic pregnancy. It took about 15 months later, we went in and we were about to start IVF. Our OBGYN made us wait a year to go in and see a fertility doctor from after the ectopic. And so that was hard to wait for that. But then once we got established with the fertility doctor and agreed that IVF was the route that we were going to go, we went to start IVF. And the day before we were to start it, we found out that we were pregnant again, naturally, or spontaneously. And so that that to me it was like, okay, well, we don't need to do IVF, and that's where we are. That ended up in a miscarriage at about 10 weeks, and so our the baby's heart just stopped, and we don't know why, and it never. Well, we didn't know why at the time. We didn't even know that it had stopped until we went in to have an ultrasound, and we learned that at the doctor's office. So that was a very hard loss to process. And that's when I started reaching out for more support from other people around us and leaning into our support groups. And then we learned that we were pregnant a third time and had a third loss. So the IVF process, we were okay with it. We were ready to start it. And then it kept getting delayed because we were having these spontaneous pregnancies. Unfortunately, the spontaneous pregnancies were not ending in the results that we were hoping for.
Can you talk to us a little bit about what a triploidy baby is? What is that all about?
So our second loss was a triploidy, and so what that means is that it had 3 sets of each of the chromosomes. And so it very likely wouldn't have survived very long after birth if it survived to birth. And so we were able to, through doing a DNC, we were able to learn the results of that. And that kind of helped us to have some questions answered and not just have the unknown of, we don't know what happened. We understood that there was a problem with the baby and that the baby very likely wouldn't have made it. So that kind of helped us in the grieving process.
Reid, what was your reaction to this second loss?
I think, I mean, each loss kind of got harder as we went along. The one after 10 weeks was really tough. We thought we were kind of finally out of the woods. We had just made some big announcements and told the family and done it all big with the reveal and had a whole planned thing. And I think it was less than a week later.
It was 2 days later.
Yeah, I mean, it was really soon after we told everybody that we found out the heart had stopped, and that one was really tough. I mean, they were all hard and disappointing, but that one we felt after 10 weeks, we felt like we were through the weeds, sort of, and on our way to a healthy pregnancy. So,
Abby, I understand that around January 2nd, 2017, you discovered you were pregnant for a third time. Can you tell us what happened with that pregnancy?
So we, I wasn't feeling right. So I took a pregnancy test expecting it to be negative. Reid went into the bathroom, saw the pregnancy test. He said, yeah, it's negative. And then I went back in there a few minutes later and I was like, actually, like if you there's a little bit of a faint line there, which I knew was not great at that point, in my cycle. And so we neither one of us celebrated it. We had gone through, lost a couple of times. We kind of felt like we knew where that was going. And after about a week and a half of blood tests, we learned that the baby just was not viable and that it just wasn't growing. And so it was another miscarriage. And we had to have another DNC for that.
Okay. Reid, I understand that by March of 2017, that you became ill again. Can you tell us a little bit about what happened?
yeah, I woke up one night just in a ton of pain. Was having a hard time breathing. I had fever and chills at the same time. I thought I was sick. Obviously, I didn't think it was anything that serious, but I went and laid on the couch because I was moving around a lot trying to get comfortable. I didn't want to wake Abby up, and then finally called her from the couch after a couple hours and was like, I need you to take me to the hospital. Something is really wrong. Got to the hospital and found out that I'd had a cholangitis flare up and effectively was my liver was infected, and I needed a lot of antibiotics to sort of knock that out. And it was a symptom of the PSC. The infection couldn't clear out, and it just backed up and got my liver very sick. And so I got a PICC line installed on the way out of that one. They would effectively just put a catheter in to and sent me home with these bulbs of antibiotic that would just over the course of 12 hours steadily inject me with antibiotic for a couple weeks. So yeah, that one, it felt like it was just an infection, but it meant that I was getting sicker. So
My notes are telling me that you ended up back in the hospital again after a very short period of time. Can you tell us what happened?
yeah, basically as soon as I got off the antibiotic, it probably started building up again. Either I wasn't cleared of the first infection, or it just it just backed up again. But basically, I went in, same exact thing. This time, I didn't wait. I felt it coming on, and I was at the hospital for probably an hour or two before I got to the point that I was doubled over in pain, because I just knew what was coming. Yeah, same diagnosis. I had to have a procedure where they went in with a very small balloon and stretched out the bile ducts that time, to try to make some room for the bile to flow out of the liver.
Spyglass procedure?
Yes. Yeah.
Okay. And I understand that Dr. Reddy, who was taking care of you, he was recommending a liver transplant at that time.
Yeah, we came out of that one, and he basically said, he's like, look, you're probably going to get cancer. We need to start the conversation. go ahead and start talking to the transplant team and get you listed so that we can start trying to figure out the next step.
Where did you end up being listed, Reid?
So I started in Houston that summer. So this was 2017. 2017.
June of 2017.
Started in Houston. I got listed there, and then at just Methodist in downtown Houston. But going through the process, learned that the list, the average MELD score, which is how they determine where you are on the list to transplant in Houston, was very high. And PSC is, I'm not gonna say it's unique, but it is different in a way that it does not affect your MELD score. So I was very sick and likely would have developed cancer, but my MELD score at that time was about a 16, which never would have gotten me a transplant in Houston. Talking with the doctors here, we had talked about options, going with subprime livers and other options, but they said, we encourage you to take every opportunity you can. And we took that to mean that we should try to get listed somewhere else. I'm from Indiana, as I said, so I still had some friends and family up there. And I was listed at IU Hospital late that year. And then we continued to try to get listed elsewhere. We tried Emory Hospital in Atlanta, and then we tried University of or UAB in Alabama, yeah. And both of those did not pan out for one reason or another. And then finally we were listed in Cleveland. This is later in the process. We got listed in Cleveland as we started looking for living donor.
Okay, and so people understand, Reid, the MELD, the model for end-stage liver disease range, is from 60 to 40, and yours was at 16.
It's from,
and
yeah,
for example, Houston was looking for 35 to do a transplant.
Right.
I have that right? Okay.
Yeah.
And different centers have different kind of average MELD scores that they're transplanting at, and that just depends on who's listed there and what, how what their donor registry looks like and things like that. And so that's why it was good for us to go to multiple different locations, because they were transplanting at different MELD scores at those locations.
Okay, well, on this program, we always recommend multiple listings, so that doesn't surprise me. Abby, how did you handle the news about Reid's condition?
Not well. I knew as soon as he went back for that procedure that something was not right. We had been through several of those procedures before, and it was taking a lot longer. And my mom and his parents were there with me, and they finally called me back to speak with the doctor, and I could just tell by his face, like, we knew him very well by this point. And whenever Dr. Reid explained to me that it was now time to have him listed for a transplant, and that he had a 90+% chance of developing cancer in his bile ducts, which is very deadly cancer, it really took me back. I think that I had lived in denial, and I had been so focused on our journey to creating a family that I wanted to pretend like he wasn't sick. I did not want to see that was actually a possibility, that he would need a liver transplant one day. I didn't want to admit that. And so it was a huge reality check. And I walked out of that conversation very upset, and had a really hard time relaying the information to our family.
Reid, one of the things that I kind of learned as I was reading Abby's book was that when you're evaluated for a liver transplant based on a MELD score, you may have a low MELD score, but still have a need for a transplant. Can you talk to us about that a little bit?
Yeah, so like I said, mine was a 16. My MELD score was some transplant centers won't even list you until you're a little bit higher. When I mentioned that Emory didn't pan out, so that one didn't pan out because when I applied there, my MELD was down to 10, and they would not list anybody below 15. Effectively, they're just saying, look, you're not sick enough. You're not going to get a liver. Come back when you're sicker. And once you're on the list, the reason we were trying to get listed is once you're on the list, there are ways that you can get what are called exception points. It allows you to kind of climb the list a little bit based on how sick you are. If you're hospitalized numerous times over a certain period, or if you're diagnosed with cholangiocarcinoma, for example, there are avenues to get exception points, which gets you higher on the list. But yeah, I mean, I didn't feel like my liver was failing. I felt like, I mean, it was, as it turns out, but it didn't feel that way. I felt like I was going to get cancer, and there wasn't, like, it was a race against that rather than a race to get a new liver before mine failed. It was a race to get one before I had cancer. Right. And so we were very low on the list, but yeah, still very active trying to find a liver.
Okay. Abby, please explain to us about the decision that was made to freeze Reid's semen and to go through the IVF process despite the costs.
Yeah, so shortly after he was listed at Methodist, we had to have some really tough conversations. We went back and spoke with our fertility doctor that we had seen right before we had gotten pregnant. And we had been keeping in touch with him. He had actually followed our last 2 pregnancies. And so he actually reached out when Reid was in the hospital. He heard that he was in the hospital and called me to check on him. And so he was very aware of our situation, and he was very he approached it with a lot of compassion, and really helped us to figure out, okay, if the worst were to happen, or so if he were to get cancer, and he were to go through chemo, he may not be able to have kids anymore. So that was one of the things that we just said, you know what, let's just do this as a safeguard, just to kind of have that extra layer of protection.
Okay. I understand there are some pretty phenomenal costs that are involved with IVF. Can you tell us about the cost and your fundraising campaign to meet those costs?
Yes. So yes, IVF is expensive. Anyone who has ever said, well, at least you can do IVF, has obviously not looked at the cost and the mental and the physical and emotional toll that it takes on you, because it's a really hard process, not just financially, but mentally and physically as well. And so it was about $20,000 per round of IVF. Each round had about a 60 to 65% chance of ending in a viable pregnancy. And so you end up spending a lot of money to maybe have a baby. But we felt at that point, Reid actually kind of pushed back against it and said, look, he kind of kept his feelings to himself for a while. And then finally he said, look, I'm afraid that you're going to end up pregnant and I'm going to leave you a single mom. And my response to that was, if that were to happen, which I wanted to block that out of my mind. But if that were to happen, like, I would have felt better having a piece of him here and having the challenge of being a single mom as opposed to him leaving and not having a child with them. Which is a really tough conversation to have, as still somewhat newlyweds, a couple years into our marriage. But those were the kind of conversations that we were having, and so we agreed to move forward with it. And a lot of times our IVF cycles were dependent on the results that we got back from a liver transplant team. Okay, well, if this team, says that we can get exception points, like if IU had given us exception points, we were then going to, move up to Indiana potentially. But they didn't, so we started a round of IVF. Fortunately, we had a huge support system behind us because I had started blogging after our third loss. And I started sharing about our pregnancy losses and infertility. And then when Reid was hospitalized, I also started sharing that. And so we had a huge amount of support behind us of people that wanted to help. And finally, my mom said, look, please let me start a fundraising campaign. And both of us felt very uncomfortable with it at first, but then we realized that it was just something that we had to do in order to be able to move forward with that, while also traveling to these different centers to get him listed for transplant. And we were very fortunate that we had a lot of people that supported us in that way.
I understand that through the fundraising campaign, you were selling T-shirts,
Mm-hmm.
and that you sold over 700 T-shirts.
Yeah, it was amazing, the number of people that it kind of became this movement, because so the shirt said "Expect Miracles," and I've got one similar on. It's a newer model of it, but it said "Expect Miracles" on the front, and then the back said "A grateful heart is a magnet for miracles." And that was just one of those things that kind of struck me throughout the process, where I kind of held on to that "expect miracles" phrase. And that can be applied to so many different situations. And so people started buying it, and it just kind of became this movement where people rallied behind not only what we were going through, but also just supporting one another through struggles.
Okay. And so the folks know that are watching this broadcast, if you followed Uncle Jim's broadcast before, you know that this broadcast is pinned to the top of my Facebook page, Jim Myers, Myers. And all of my research for the broadcast is in the comments that are pinned to the top of the page. And that includes links to all of the things that we've been talking about, and all of the definitions that we've been talking about, and photographs like the photographs that Abby's talking about the T-shirts. And let me see if I have those with me, Abby.
We had a lot of people sending in pictures, so it was pretty amazing. Yeah,
That's a T-shirt you're talking about?
Yes, that is the shirt.
All right, way to go, Jim.
You got it.
All right. Abby, tell us how this IVF process works, and how did your first egg retrieval on September 16th, 2017 go?
So I was terrified going into the IVF process. I was a person who was completely terrified of needles, like would get nervous days before having to get a shot or blood work or anything. Like it was an issue. But I knew that I had to push past it, because my wanting children had to be greater than that fear that I had. And so we started our first round. The actual process of it was not as bad as I had expected. I quickly got used to, I guess, the shots. Reid did the shots for me for the first round or two. But we went in for our egg retrieval, and we were able to retrieve 4 eggs, 2 of which fertilized. And they made it to day 6, where they were biopsied and frozen. So we went through a PGS testing where they test the chromosomes in the embryos. And we later learned that both of those embryos were abnormal.
Okay. Reid, my notes are telling me that in the fall of 2017, I understand that you had a spyglass procedure that came back negative for cancer, but the doctor's notes were indicating, quote, highly suggestive of malignancy and, quote, very high risk of developing cancer. The possibility that you could develop cancer in your bile ducts before you received a kidney transplant, how did you feel about that?
Yeah, we had warped our brain through this whole process. I was actually at a point where, because we were listed in 2 places, I was at a point where I was almost wanting a positive cancer diagnosis, and that's insane to say now. But I wasn't going to get a liver, right? It was pretty apparent to me that it wasn't going to happen normally. I was either going to have to get very sick, or get this positive diagnosis, and then I would have to beat cancer, and then I could transplant. There was I was at a point where, like, I wasn't. I think it was sort of a wake up call. We had to sort of kick into gear even harder to try to find a liver, but at the same time, I was also like, if we get it, we'll deal with it, and maybe that's what it's going to take to get a liver. Very fortunate that that's not the route that it ended up going, but that's how I felt at the time.
Okay. Abby, what was your reaction?
It was definitely scary, and it was one of those things where our doctor had said, all along that a living donor liver was our very last resort. And at that point, he said, "You know what? It's time to go with that last resort." And so that was another reality check for me, that we were in a position that was worse off than we thought, especially after learning that none of our embryos were normal after the first round. Those 2 blows were pretty hard.
Okay. Abby, please talk to us about your second egg retrieval in November of 2017. What went on there?
So the second egg retrieval, we tried things a little bit differently. We were able to retrieve 7 eggs, which was huge. We were so excited about it. And then 2 of those made it to day 6 to biopsy and be frozen. And then another 2 weeks later, we found out that both of those embryos were also abnormal.
Wow.
Yeah.
You have persevered through an awful lot, my friend. Reid, talk to us about when you first learned about the possibility of a directed organ donation in February of 2018.
Yeah. So we knew that it was a possibility. It wasn't something we really ever entertained, but we got a call, or Abby got a call late one night on Facebook, actually, and sort of, like, I think initially she ignored it, and then was like, "Why would somebody be calling me on Facebook at 3 in the morning or whatever time it was?" Decided to get up and check. Found out that it was a friend who she hadn't talked to in a long time, so she called her back or messaged her back.
She sent me a message saying, "I know of a potential donor."
And it's sort of like, prior to that, it wasn't something we considered an actual possibility, and that conversation was like, okay, wait, our story is out there now. People are aware of it, and now all of a sudden we have this person who I don't know is potentially trying to coordinate me getting a liver. It was pretty incredible, actually.
Wow. Abby, tell us about your surprising conversation with Dr. Griffin in May of 2018 about no embryo testing. I was trying to understand that. Third round of IVF, no embryo testing. What was that all about?
Yeah, so Dr. Griffith, he is amazing. Anybody in Houston that knows him will tell you that. But we went into, discuss a potential third round. And honestly, I thought he's going to tell us not to go forward with another round. We had two of our spontaneous pregnancies had abnormal chromosomes in the embryos, and not the same abnormality. And then all four of our embryos that tested abnormal had a different abnormality to them. And so there's a lot of question around the PGS testing, and especially at the time, and with regards to mosaic embryos that can have both normal and abnormal cells, but they are deemed abnormal. And so there was just a lot of kind of gray area, and he was like, you know what? I say we just not test this time. And Reid and I were both like, what? Like we actually saw Dr. Griffith this past weekend and had a conversation with him about it, because we were like, we thought you were crazy when you said that. But he was like, you know what? It hadn't worked for us the last two times. Let's try a completely different protocol for your medication. Let's not test. Let's give these embryos a chance. Let's try for a fresh transfer first. Let's do things differently. And we really trusted him, and we knew that he really had a good grasp on our entire situation. And so we were like, okay, all right, well, let's do it. So yeah.
Okay. Reid, I understand that in the spring of 2018, you had yet another spyglass procedure, and as a result of that, it's my understanding your doctor fully believed you had bile duct cancer. Can you tell us a little bit about that?
Yeah, he told us after the procedure that he thought it was positive. We took a lot of biopsies. He told me that he wasn't sure if he got it. Like, he said, it's really hard to tell. Everything is scarred. Everything is inflamed. It's very hard to tell what's a biopsy, which is why cholangiocarcinoma is so difficult to diagnose sometimes. But yeah, he said he took a bunch of pictures, and he said, look, if I showed these pictures to 100 doctors, they would all say that you had cholangiocarcinoma. We'll see what the biopsies say, but that's my conclusion after this procedure, is that you have it.
It's my understanding the biopsies came back benign.
Yeah. We didn't know what to expect with anything at this point. But after that procedure and his comments, we were kind of surprised to hear that everything was benign. As I mentioned before, I was almost a little bit disappointed because it meant that, again, we were stuck with very bad news and no ammunition to do anything about it.
Yeah.
And while you were testing for Emory, it's my understanding that later they declined to list you.
Yeah, because I think I said earlier, my MELD at that point, I seemed to be in relatively good condition, in my opinion. My MELD score was around a 10, and Emory would not even list me. They agreed that I was sick, but would not list me at a 10. They said I would have to come back when I was sicker.
Wonderful.
Yeah.
Mm-hmm.
Please come back when you're sicker. Oh gosh. Abby, while Reid was doing this testing, Emery, it's my understanding you started your third round of IVF injections.
Good.
Can you tell us what occurred in the summer of 2018 with your third egg retrieval, your first embryo transfer?
Yeah, so we went through our third round of IVF, and we had completely changed the protocol for egg retrieval. And we had, it seemed like it was going to be better results. And our doctor had said, look, I vote that we go for a fresh transfer. So that means that 5 days after the eggs were retrieved, and then they are immediately, what's the word? No, not implanted. They're fertilized. Thank you. They're immediately fertilized with Reid sperm there at the clinic, and so 5 days later they said, look, let's just go in for a fresh transfer right afterwards. So that means we're, since we're not testing them, we can do this. And so 5 days after that egg retrieval, we went in, and we weren't sure how many embryos we were going to have, if any. Whenever we got there, we found out that we had 2 embryos that were just before the stage that they went to see them at before they transfer. It's called the morula stage. They like to see them at the blastocyst stage. But our doctor said, look, since they're at that stage, I say we just go ahead and transfer both of these 2. And so we said, okay, well, and I think Reid was like, really? Are we really gonna like try for twins? Like, is this really and I'm over there going, yeah, we are. Like, this is this is what we're doing, and we're moving forward. So we went forward with it. Yeah.
Okay.
Yeah. And
What were the results?
so that one, we found out about a week and a half later that I had a chemical pregnancy. So that means it was a very early miscarriage. So I did show as a positive pregnancy test, but the following day, the babies had no longer made it.
It's my understanding that on June 14th, this is when you learned for the first time, about the possibility of having twins.
Yes. Yeah. So that's when whenever we transfer the 2.
Okay. Now, what I've learned so far about my friend Abby is that she's a pretty proactive person. I guess that's an understatement.
Yeah.
And I have a note that you and your friend Nate set up a website to find a direct donor for Reid. Can you tell us about that a little bit?
Yeah, so it's actually one of Reid's best friends, Nate, and he still lives in Indianapolis. But he, the first time that Reid got sick, he immediately kind of sprung into action and was like, "Okay, you're not just, I'm not just going to ask you what I can do. I'm going to suggest some things and see if you'll let me help here," which was really, really helpful. And so he and I worked on a website to basically find Reid a liver. So we put all of the information up there that someone would need to know if they were going to do a directed donation. And then we also put information on there about the fact that we would soon be seeking out living donors to start testing and to kind of stay tuned for that information. So we were trying to get the word out as much as we possibly could at that point.
I understand that you were contacted by a nurse from the Cleveland Clinic about a possible lead on a living donor.
So she actually because I had Instagram and Facebook that was more dedicated to sharing our infertility struggles. There is a huge infertility community on Instagram that's really supportive of other people. And so I had connected with so many amazing women there. And she was also going through infertility. She saw my post about Reid also needing a liver now, and that we were potentially going to try to explore a living donor option, she reached out and said, "Hey, I am a nurse practitioner at Cleveland Clinic. I work with the transplant team. I would love for you to, like, if you want more information about our program, I would love to give that to you. I will meet you whenever you come up here. I will, I will support you in any way through that." And so it was just one of those, many situations where we had the right person put in our path at the right time.
It's my understanding that ultimately Reid was not able to get listed in Cleveland. Is that a correct understanding?
No, in Cleveland, he was able to
Yeah,
get listed.
Yeah, it took a trip up there for me, and then a lot of follow testing. But I did finally get listed, but only for the living donor program.
Yes.
So
Okay.
I was not on their normal list for liver transplants, but as a recipient of a living donor, I was on that list.
Okay, great. Thank you for straightening me out. Abby, let's talk about the embryo transfer round 2 that occurred August 1st, 2018. Can you tell us what happened?
Yeah, so we went in. So the day after we transferred what we thought were only 2 embryos, whenever we went in for the fresh transfer, we got a call from the embryologist or from the nurse at the clinic, and she said, "I just wanted to call and update you that you have 2 embryos that made it to freeze." And we were like floored. We were really surprised by that. So we ended up going in for an embryo transfer, a frozen embryo transfer on August 1st. And we were really hopeful for that. I really actually thought that I was pregnant and was shocked whenever they called and said that I wasn't. So that was quite disappointing.
Okay. Abby, talk to us about the embryo transfer round 3. Evidently you and Rita decided this was going to be the last round of IVF
Yes.
previously.
So
Can you tell us a little bit about that?
Yeah, absolutely. So we had agreed that we were going to go through one more transfer. That was it. And yeah, we only had the one more embryo. I did not want to do another egg retrieval. We had started discussing other potential options. And right before we started the process for the 3rd transfer, we got a storage bill for an embryo for our abnormal embryos, and we thought that those had all been discarded, but they were in fact still frozen. And so we decided to explore the option, learning more about them and seeing if any of those were in fact mosaic. So whether they had any normal cells. So the day before our transfer of our last frozen untested embryo, we learned that one of our abnormal embryos was in fact mosaic, and we decided to transfer it with the last untested embryo. And yeah, I had a lot of hesitations about transferring an abnormal embryo, but fortunately, Reid really fought for that. So,
All right. Tell us about your conversation with Dr. Griffin on September 13th.
so
What did he say to you? What did you say to him?
So we had our transfer on September 6th. And a week later, so I was going in for blood work every 2 days. And a week later, I got a call from the clinic, and our nurse said, "Hey, Abby, Dr. Griffith wants to speak with you." And I was like, "Oh no, like here we go." And I got on the phone, and he said, "Expect miracles because you are pregnant." And then I was just like, "What? Are you sure? Are you really?" And so he said, yeah, he said, your numbers look so great that I had to call you right away and tell you. Because he knew that, where we were in the process and, with everything else and how hard it had been. And so he just couldn't wait to tell us. And that meant so much.
Okay. After this call, my notes are telling me that you had some cramping and bleeding, and there was concern. Can you tell us a little bit about that?
Yeah. So
No,
about,
nothing's easy for you folks, is it?
no. So about a week later, I all of a sudden started bleeding, and immediately my heart sank. I just knew I was having a miscarriage. We had had an ultrasound the day before, and we had seen one fetal pole and one potential sac. So we may have two in there, but we weren't sure at this point. And so as soon as I saw the blood, it was like, no, this is over. I can't believe this is over. And so I called my clinic, went in immediately, called Reid. He met me there. And whenever we had an ultrasound, that is when we learned that not only did we have one strong heartbeat in there, we had two, and I was not miscarrying. Our babies were actually growing, and it was just a side effect of one of the medications I was taking.
Abby's carrying twins.
Yes, it was. Yeah, I think Reid still has a physical reaction to that. But
Reid, how
yes,
did you find out your wife was pregnant?
Yeah, I mean, so we were at that meeting. Like I was fully expecting to find out that it was over as well. I was blaming myself for pushing us to do the mosaic embryo transfer, thinking that one had miscarried and was causing her to lose both. And so, like, it's very rare that I react in a physical manner or that I lose my breath. But when we saw the first heartbeat, I immediately started crying. We saw the second one, and I was completely speechless. Had no idea what to say. I was very short of breath. I was having a hard time breathing. It could have been because there were twins in there. But yeah, it was an incredible feeling. So
Awesome. Awesome. Concerning your experiences at the Cleveland Clinic, Reid, I read that a guy named Desmond was trying to donate to you, and this turned out to be a false alarm. Can you tell us a little bit about that?
yeah, so she was a friend of Abby's from high school. I don't think they were particularly close or had talked much since, but Abby had put our story out there with the blog and on Facebook and everything else we were doing, and he saw it and felt like he needed to reach out, that was something he was meant to do. So he contacted us and said, "Hey, I want to do this." We met him for dinner so that I could meet him and we could just get to a point where we were comfortable. I still wasn't sure how I felt about somebody I'd never met offering to provide part of their liver to me. So we met him for dinner. He was a very nice guy. He said, "Yeah, I really want to do this." So he went up. He was a big guy. He's not my size, but he was pretty big, probably I don't know, 6'2", 6'4", somewhere in there.
He was about six. Yeah.
Yeah. So but I was thinking it could work, that it might be a match with the size and everything that was needed. But in the end, all the testing they did, they found something that was not compatible with me. So as much as he wanted to and as much as we wanted it to happen, the liver just wasn't a match for me. So.
Reid, in January of 2019, it's my understanding you learned about another possible liver donor. Tell us a little bit about Clayton Sparks.
Yeah. So, so January 12th, January 12th, we were on our way to a friend's wedding reception. And we got a call from Abby's mom that she said, I'm not sure what I did. I reached out to a friend of a friend that I saw on Facebook whose son was just in a terrible skiing accident. They're at the hospital now, and I reached out and asked if they would consider donating his liver to me. And so we had a couple false alarms since then on directed donors. So I was at this point not really thinking much of it. Very happy that she was doing that for us, but we just went about our night. A couple hours later, she called again and said, I really think this is going to happen. They're trying to set it up in Colorado. It seems like he might be a match. I think you need to start preparing for that. And so we excused ourselves from the reception. The bride was someone that we had known, and she knew our story and was very happy that was something that might be happening for us. So we drove home, and on the way home, Abby called the transplant center and got a hold of the on-call coordinator and said, hey, this is in motion in Colorado. I don't know if anything has made it to you guys. One thing we had learned is that if we don't reach out and make a call, like, there is a chance that it just falls through the cracks. So you said she was proactive. She just called and said, hey, we think we have a liver. And so the nurse on the phone said, we know who you are. We were just about to call you. There's still a lot that has to happen, but it does look like it could be a match. You need to try to go home and get some rest so that we can start this process tomorrow.
I understand that, in fact, the transplant took place at the Texas Medical Center January 14th, 2019. Can you tell us about that, Reid?
Yeah, so it was 2 days of waiting, basically. So Clayton had decided to be an organ donor, obviously, but he donated to over 80 people with his organs, eye, and tissue, and it takes time to coordinate that. So it took the better part of 2 days for them to confirm that the liver was going to work for me, and then get up to Colorado and get the liver from the hospital up there. So early on January 14th, I finally was wheeled back into the center. They didn't have the liver yet. I was wheeled back, and they started the procedure while the liver was en route. And then I woke up a couple days later. Abby is the only one who knows what happened in that time. So.
Yeah. Speaking of which, Abby, you guys are like a modern day Job. I understand there were transportation issues with getting the liver from Colorado to Texas, and you had to make a call to go forward. Can you tell us a little bit about that?
Yeah, so we were very fortunate that they came in before the transplant, before Clayton's surgery in Colorado, and we're having to sign paperwork, and the medical research team came in and said, look, we have an opportunity where you can be placed on this trial for a perfusion machine to be connected to the liver. Now, they do this with kidneys a lot, which I'm sure you know, but at this time it was a very new procedure for, it was something it was absolutely in trial for livers. And so they said, would you like to do this? We said, yes. then they put it into the system, and we were selected. So we knew that his liver was going to be on a perfusion machine during transport. We also knew that it was coming from Colorado. And so the transport took a little bit longer than expected. The liver was on the perfusion machine a little bit longer than they expected. And so I thought that Reid was back in surgery and that they had kind of started. And next thing I know, our three transplant surgeons walked out into the waiting room and pulled me aside and said, "Look, there are some challenges, and we're a little bit worried about potential complications. That this is a riskier surgery now, and we can't move forward without you saying that that's what you want to do." And that was definitely a tough conversation. I'm really glad that my best friend was there for that. Reid's parents had just gone back to take a nap in the hotel room. We really thought that surgery was underway. And so of course we called them, and they came rushing back, and we all had a conversation about it, and agreed that we were going to move forward with the surgery.
Okay. What was the final result of the transplant, Abby?
That day, it was hard because he once they put the liver in his body started shutting down, and they almost lost him on the table, and so that was a really, really hard thing. They did not finish the surgery that day. They closed him up, and did not reconnect the bile ducts, which I reached out to my nurse practitioner friend now and a couple of other people, and confirmed that was something that happens sometimes, and that could be okay, for them to finish the surgery the next day. And so I was able to lean on the resources around me to kind of help guide me through that. But the next morning he went in, and he had his bile ducts connected, and he seemed to be doing much, much better. So it was from there it started to progress, and the outlook was looking better.
2 days after transplant, there was a checkup. How did that go?
For the babies, yeah.
For
So
his liver transplant.
so it was about a week later when he was released from the hospital. 2 days after he was, his body started accepting the liver. So I think that's what we were. Yeah.
Okay. I understand, Reid, that at some point in time after you were home, you had to go back to the emergency room. There was a CAT scan. Can you tell us about that?
Yeah, so I left after a week in the hospital. The first time I came home, that was, I think, a pretty standard time to be in the hospital. I didn't feel great, but I'd actually gotten sick a couple days before. Was having a hard time keeping down a lot of food, but they thought that I was okay to go home. I came home, and overnight was starting to experience quite a bit of pain. The more that I was consuming food, water, all of my meds, the harder it was to swallow, the more pain I was in. And I realized that at a certain point the next morning, I think it was about 10 o'clock the next morning, I realized that I was not going to be able to take my medicine anymore because I couldn't get anything else into my body. I went to the emergency room. I went to the clinic first because they said to come there first. I'd be seen faster. My nurse practitioner walked in, saw me, and said, "No, you need to go to the ER." Like, did not ask questions, just immediately said, "Okay, go to the ER. I'm going to call them. We're going to get something. We're going to try to get you admitted by the time you're over there," which, I mean, it's a walk, but I was admitted by the time I got over, sat in the ER for what seemed like 12 hours. I don't know. It was a long time. I was hiccuping. Turned out that I had some scar tissue, which probably wasn't even related to the transplant, just scar tissue in my abdomen, but my intestines had wrapped around it. And it had constricted my intestines. And so anything that went in was not going anywhere, which is why I couldn't swallow anything. It was just, I was full of water and everything else. And so I had to go back in for surgery that night for them. They opened me back up and found the problem, and sort of untangled my intestines, I guess. And yeah, so I spent another week in the hospital for that.
Okay. Subsequent to that, has the recovery for the liver transplant gone well?
Yeah. I think every transplantee has their issues. I wouldn't say that I'm healthy by any stretch, but I feel good. I'm healthy for me, and I've had a couple challenges, but for the most part, it's been pretty good. My liver numbers have been great since the transplant. I've not had any issues with the liver. It's mostly just dealing with the immunosuppression and the sickness. So
Beautiful. Beautiful. Abby, April 11th, 2019. Tell us what happened.
So my mom came by to pick me up for a doctor's appointment to check on the babies. And as she got here, my water broke. And so the babies decided that they were coming early. It was about 6 weeks early. We rushed down to the medical center, and they ended up doing a C-section that night. And Oliver and Kaylee, our twins, were born at 11:48 and 11:49 on April 11th, 2019. So just 3 months after his transplant.
You were telling me before the broadcast, your children are 7 years old now?
6, yes, they just turned 6.
Okay.
Yes.
And they're healthy and happy?
Oh yeah. Oh yeah.
Excellent. Sounds like 2019 was a good year for the two of you guys.
It was.
Yeah.
It will forever be our year. Yes.
Okay. I understand, Abby, that you published a couple of books that I mentioned in the introduction. If somebody wanted to buy your books, where is the best place to find them?
So you can find both of the books at abbygraywrites.com. And you can also find them both on Amazon, Barnes & Noble, most major retailers. So the titles of the books are Impatiently Waiting for Miracles. I know you have your copy too. There we go. And Clayton Sparks Leaves His Mark. That's my children's book.
Excellent. Excellent. Do you have any plans in the future to do any additional writing?
To be determined. I think right now I am so focused on trying to get the audiobook out for Impatiently Waiting for Miracles and trying to market that. But whenever I originally wrote Clayton Sparks Leaves His Mark, it is about our donor, Clayton, and the incredible impact that he made on people while he was here, as well as the incredible kindness that he shared by donating his organs, eyes, and tissue. And we've developed a really, really close relationship with his parents. And so whenever I initially wrote that book, I thought, it would be fun to do a kind of a series on Clayton, and but I don't know. As our kids get a little older and they're learning to read and write and understand, kind of more what these books mean. It's kind of fun to watch it through their eyes. So we'll see.
Okay.
Yeah.
Fair enough. Let me ask both of you, talk to us about your advocacy experiences since the time of the liver transplant and the birth of your children. Ladies first.
So I actually, let's see, in 2020, right before the pandemic hit, I reached out to Life Gift, which is our local organ procurement organization. And I became an ambassador of hope. So I started sharing our story through that. And through being an ambassador with Life Gift, I was able to make some really great connections with other people. That's where I was introduced to my publisher, Brenda Cortez, which I know you also know her, and a lot of people in the organ donation world know her as well. But then after I published the book, I was also introduced to a Children's Transplant Initiative. And whenever I met Ross and Cheryl Whitty, who run the organization, and heard their story, it was kind of where I was meant to be. And I knew that I needed to get involved with the organization and help in a way, because they support pediatric transplant families in Houston, Dallas, and Austin. And so I'm now chairman of the board for that. Last year got involved with Chris Klug Foundation and a couple of years ago, and then last year was awarded the Community Champion Award at the CKF Awards last year. So that was a huge honor. And we participated in transplant games, and I share our story any opportunity I can get, really.
Yeah, so I played in the
So
games.
Reid, who's number 24?
Yeah. So I played in the Transplant Games of America last year. I wasn't sure what to expect. I ended up having a ton of fun. You go and it's hundreds to thousands of people who have had transplants, and they're out there competing in just about every activity that you can think of, and showing that the transplant doesn't have to keep you down. So had a ton of fun with it last year, and I plan to go to Germany this year in August to play in the World Games.
Methodist,
so very excited for that.
Transplant Center at Methodist Hospital here in Houston is actually sponsoring the two of us to go so that Reid can play basketball on Team USA. So
All right.
yeah, we're excited.
Okay, we're in the home stretch, folks. Abby, do you have any final statements that you wish to make to our audience before we conclude the broadcast for the evening?
So I think just basically, I mean, I share our story because I feel like we lived it in order to not only spread hope to other people, but also to help others understand how you can support people who are going through tough times like that. Our story, that I share in Impatiently Waiting for Miracles, it's not just for people who have been through infertility or chronic illness or liver transplants. It's for anyone who has gone through anything where they feel like they're not going to make it to the other side, and where they don't, you just a reminder that you never know how your story is going to turn out. I also do want to, point out the fact that yes, we did now receive all of the things that we had prayed for so long, and 2019 was an amazing year for us. But that also came with some mental health challenges for me as I processed all that we had been through. And so I don't want it to ever seem like it was something where a switch flipped, in 2019, and all of a sudden everything's great now. We finally got everything that we had prayed for so long, and then I was diagnosed with PTSD because there was a lot of trauma that we had gone through that I had never really fully processed. I just kind of kept pushing and going. And so I spent a lot of time going through therapy and with medication and things like that. So I don't ever want it to seem like it was just this easy switch for us. it was a process that we kind of had to work through to get to the point that we are today in order to be able to advocate for others.
Okay. Reid, same question. Do you have any final statements you wish to make?
No, I mean, mostly just that before we went through this, these were not communities that we wanted to be a part of, but going through it, you realize how many people are affected by infertility. It's like 1 in 4 couples, and organ donation. The organ donation community is huge. Everybody knows somebody who's had to deal with it somehow. So it affects so many people. Going through it and being a part of the advocacy that Abby mentioned, I get to meet all these amazing people and hear all these amazing stories. I wish they weren't going through it, but the people are amazing, and I feel like our lives have been very enriched by the communities that we're now a part of. So,
Absolutely.
Well, the two of you have such amazing stories to share, and what a tremendous broadcast this has been. I've never had anything quite like this before. It's been a tremendous experience. I want to thank you for coming on and sharing your story with us. And I've kept you guys for over an hour and a half, bad Uncle Jim. But
Okay.
just a terrific stories. And I'm so happy that the liver transplant has worked out for Reid, and that the two of you have beautiful young children, and just amazing, everything that you've overcome in order to achieve your goals. Just amazing. You're a sterling example to the rest of us to never give up.
Thank you.
Just never give up.
We appreciate you letting us share our story and taking the time to read the book as well.
They ought to make a movie from your story.
Hey, that's my goal.
Seriously.
That's my goal. We may make it happen in the next few years. So we'll see.
God, well, that I know I'm going to come watch.
Okay. We'll get you to the premiere.
All right, I'm going to let you folks go. I have a few things to button up with my audience, who's going to be on next week, that type of thing. But I just want to say thank you again, and to let you know, I will create a replay. I'll be sharing it to all 100 plus of my Facebook groups and on all my platform, and we'll try to share it through the next couple of weeks or so. And there's another 100 groups where I have permission to post my broadcast. I'll post it to them, and hopefully I'll have all my posting done by Saturday afternoon, and folks will be watching your broadcast.
Wonderful. Thank you.
All right. Thank you, folks. I appreciate you coming on, and please say hello to your children for me.
Will do. Thank you so much.
All right. You have a good night.
You too. Bye-bye.
Bye-bye now. Well, that is our broadcast for this evening. And wow, what a liver and pregnancy story that was, huh? So next week, I have Robin Rose is going to come on. We're going to talk to her. She's written a book. I think she's a doctor. Your poor Uncle Jim forgets things. But at any rate, it should be an interesting broadcast, so you're going to want to check us out. And thank you for allowing us to come into your home and watching our broadcast for the evening. And I will see you again next week. And I'm looking forward to another great broadcast and replay coming up with Rose next week. So we'll talk to you soon. Bye-bye.